listening to the Turn Autism Around podcast, episode number 178. Today, I had the pleasure of speaking with Theresa Richard, who's both an SLP and the mom to a 6-year-old with a rare genetic disorder, but also was diagnosed with autism at the age of 4 or 5. And he is non-ambulatory, nonverbal. We talk all about how she moved from state to state for better services. We talk about his need for, feeding help and PT and a really multidisciplinary team, and her positive experiences with ABA. And we also talk about Theresa's specialty, which is all about swallowing. She has a podcast, a book, and has reached millions of people through all of her efforts to train SLPs and even patients on swallowing. So it's a great episode, part personal, part professional, filled with a lot of great information, some of which I learned today. So let's get to this really great interview with Theresa Richard. Okay, Theresa, thank you so much for joining us today.
Yes, thank you for having me, Mary.
Yeah, so I heard you do an interview with my good friend Rose Griffin from ABA Speech, and I listened to the whole thing. It was great. And I'm just excited to talk to you today because you have a different kind of journey than I've interviewed before, of the people I've interviewed. So why don't you tell our listeners about your fall into the autism world?
Yeah. So I am a medical speech pathologist by trade. I worked with patients with swallowing disorders. I have a brother with cerebral palsy. So I, very much immersed in, the field of disabilities and special needs. I got pregnant with my son 6 years ago, and they had suspected something. They originally said perhaps it's Down syndrome, but they couldn't identify exactly what abnormality it was until he was born and we had more further genetic testing done. So my son was born with a very rare chromosomal abnormality, a very rare trisomy of 2 different chromosomes that doesn't even have a name. So we don't even have a name like Down syndrome or Angelman syndrome. So at the time that he was born, there was only 9 other documented cases in the world of this specific chromosomal abnormality. I believe now there's 20 documented cases, but I think still not enough for us to get a fancy name and a community to go with it. So that was sort of hard for me because I didn't have really an identity or a support group when this all happened. We had the most wonderful neonatologist in the NICU, and she just said, these are the documented cases. He could be on a trach and vent his whole life. He could grow up and work and, have a very normal life. So, she was like, I don't really know what to tell you the prognosis is, but I'm going to help you get as much care and therapy as early on as possible because, we know early intervention works. And so she was really wonderful in sort of not pigeonholing him into, okay, this child has, a very rare chromosomal abnormality, and just sentence him to a life of whatever, but instead she was very encouraging and open-minded. And I think that changed the trajectory of everything. But like I said,
how long had you been an SLP at this point?
8-9 years, maybe.
Okay.
Yep.
So you were familiar with the medical field and everything, but still your first child as having some rare genetic chromosomal abnormality. I mean, how were you feeling back then?
Yeah, I mean, just awful. And I think, the worst part, like I said, was that we didn't get a community to identify with. It was like we didn't identify with Down syndrome. We didn't, I had a friend that had a son with Angelman syndrome, and she got to go to all these support group meetings, and, they did all this genetic testing, and we didn't have that. So it was very lonely and isolating in that aspect. Also dealing with therapists, it's something that I've really it's become a passion of mine, is really to help therapists ask the right questions and to approach things in a very patient-centered way. There was sort of a lot of therapists projected their own thoughts and beliefs on me and on my son and how they thought things should be. And I've learned a lot about that. And I teach a lot about sort of the patient preference and the patient side of things, and the family and the caregiver. Obviously, that's one whole big bundle right there. But there's so much to be said about how to approach that and to take their feelings and considerations into effect and not just project what you believe they should be doing or what interventions they should be going after. So he had PT, OT, speech, feeding, vision therapy. He had the gamut literally a few weeks after he was born. And then it wasn't until he was, I believe 5. I'm trying to think how old he was, 4 or 5. And we ended up moving to Florida in the middle of the pandemic because New York shut down all services for kids with special needs. And we just saw behaviors on my son that we had never seen before. It was absolutely awful. It was gut-wrenching. It was not my child. But he just was so out of his routine. He was so used to his therapy routines, and it just was very structured and regimented. And then once COVID happened and there was none of that, it just spiraled. So we ended up coming down to Florida where he could get the services and we could get the help that we needed to sort of get him back on track. And we decided to move down here, and we started looking for schools. And, what's so interesting is moving from New York to Florida, the school systems are just so different and so opposite in the way that they work. And I think what's funny, I don't know, I've always sort of beat to my own drummer, but when we moved to Florida, I had so many friends say, don't move there as a parent of a child with special needs. Do not move to Florida. Their system is so messed up. You have to do everything. You have to find everything for your own child. And my experience was the complete polar opposite. I don't want to, we had wonderful therapists in New York, but I think the system up there frustrated me beyond belief. And when I got to Florida, it was almost an instant relief because we were able to choose and identify our own therapists. I basically got to assemble my dream team. So my son goes to a private school, but the way that Florida does it is you get a scholarship to go to a private school, and I get to bring in all his therapists. So we have PT, OT, speech. We have all the therapists that come into the private school. So the school that we found for him was beyond amazing, beyond my wildest dreams. And like I said, we were able to assemble our dream team, which a lot of people discouraged me from doing because they thought that's so hard. You have to find all your own providers. And, I just sort of put a positive spin on it. Like, I get to find my own providers. Like, that sounds wonderful. Right. But I can't remember how it exactly happened, but I think in Florida, you have to have, there's a few specific diagnoses that you have to have in order to qualify for services. And I know autism was one of them. And I just remember, he had one therapist and she said, well, does he have an autism diagnosis? And I said, no, he doesn't have an autism diagnosis. Like, my brain was so focused on his chromosomal abnormality. And I just assumed that every single behavior that he exhibited, we attributed to that. And she's like, well, I really think you should get him assessed for autism because he has all of these, he has some sensory, pieces that would basically, what am I trying to say?
Yeah. Would mimic that.
Yeah. So we met with the psychologist, had a whole evaluation done. And I just was really shocked, to be honest, when she said, yeah, we're giving him a diagnosis of autism, and these are all the supports that we have. And this is all the, sensory therapy with OT, and this is all the ABA that's available to help him. And I just remember being like, my son does not have autism. Like, it was such a weird thing, but at the same time, it was like such a relief to all of a sudden be able to get all of these services for him. So I think for me, like, I hated the whole label stigma that came along with it, but I was so grateful for it because it just opened the floodgates to so many services and just so many wonderful providers that we've met since then. So I guess that was sort of my fall into autism.
Yeah. And as an SLP, you were focused more on geriatrics and
Yes,
not on young
kids.
children.
Yeah,
So you weren't an SLP constantly in the trenches over early diagnosis and those sorts of.
correct. Yeah,
So your son is how old now?
he is 6.
He's 6.
Yeah.
So can you describe what his skills and deficits are right now?
Yeah. So he's nonverbal, he's non-ambulatory. He uses a little gait trainer to get around. We are working with an AAC device, so he's made so much progress. He progressed right through PECs right away. And now we're just using an iPad while we're trialing different AAC, communication devices, and he's just doing wonderfully with it. I think everybody always says they just want their child to be happy and healthy, and he is the happiest, healthiest child ever. He has no major medical conditions, which is, such a blessing. But yeah, it's interesting to have a child be so happy that's nonverbal. I think there's so many things that, especially as a speech pathologist, I know something we want our patients, our kids to be able to communicate effectively. And, how frustrating is that to not be able to? And, I don't want to sugarcoat it that every day is rainbows and butterflies, because it's not, but he's genuinely just the happiest kid. And I'm so glad that we found the right supports, and we have such wonderful therapists that have helped us, sort of get ahead of the curve before he spirals into some of these behaviors. So, we've gotten very good at anticipating his needs. And yeah, I know some people don't agree with that and don't like that, but it works for us. So
Yeah.
yeah.
So we have several shows. As you're talking, I'm thinking of, we do have a podcast interview with a panel of a few SLPs, including Rose Griffin, and that's on AAC devices. And we talk about that. So we can link that in the show notes. We have an interview with Cody's mom, and Cody is one of the children featured in my online course. I worked with him from 2 to 5 or 6. And initially the parents really thought he'd get a diagnosis of cerebral palsy. But he got autism first, and then he got visual impairment, and then he got cerebral palsy kind of later. We had an interview, we can link that. We had an interview with Jess from Jess Plus the Mess, whose son had a stroke in utero. And so he got kind of a late diagnosis of autism, kind of the similar things as he was having, some of these autism traits, but they were, constantly going back to the stroke in utero or the rare chromosomal abnormality. Also, we did an interview with a woman who has a son with Down syndrome, and she's a behavior analyst. And in doing some research for that podcast interview, realized that a good percentage of kids have both autism and Down syndrome.
Yeah.
So I think this combination, we have people in our online communities who post that they have a child with XYZ chromosomal abnormality that do have a name for it. But, there's, like you said, there's no support groups for that small little thing.
Mm-hmm.
And so with or without a diagnosis, people can learn, and get support online. So those are all really good things. I do think your move from New York to Florida and that seemed like it really opened up a lot of things for you and your son. I usually tell people not to move.
Yeah.
Because, I say this in my first book, The Verbal Behavior Approach, is that, you should, in ideal situations, now I do want to talk about your situation because I think it was completely unique, but in normal situations, it's like, you could be like, where I am in Pennsylvania, and it's like, when Lucas was diagnosed, and people definitely move, and they move to another state, another county, school district, people quit their jobs, you disrupt siblings, whatever. And you get there, and then you find out classroom A that you thought was going to be good is is too high functioning, quote unquote, too low functioning. The school board changed and they got rid of it. They're now shipping out kids to this, whatever kind of school. The teacher got pregnant and left. And so you just disrupted your whole life for not really, not a good situation. And so I've done several episodes, podcast episodes on advocacy. I've always been a true believer in like staying put and advocating. However, I also did a few episodes on COVID and how the shutdown just totally, affected so many kids. And I can just imagine, I mean, it affected our lives. It affected my 25-year-old son who couldn't go to his day program and, suddenly shut down and, threw a curveball. I don't think in anybody's life, there's no one listening that it didn't completely affect their life. But when you have a non-ambulatory, nonverbal child who's getting therapy and services, many hours a week, and then they suddenly go like, hey, we're doing Zoom services. It's like, are you kidding me?
Yeah. We had the most wonderful PT. We had her since Cam was maybe 3 weeks old. I think she was just such a blessing to our family, but she was so funny and she was so frustrated because she's like, I can't do this over Zoom. Like, I can't tell you to feel behind his leg and what muscles should be firing. Like, she was just as frustrated as we all were, and I understand it. I very much understand it. But for some kids, it wasn't acceptable.
Yeah. So, what kind of school is he in now? Is it considered an ABA school or?
So not considered an ABA school. So it's actually a private school that has, basically it's a private school that has sort of a separate little school attached to it for kids with special needs. And it's really what it is, for any kid with special needs. They will bring in any service that you need. So you're allowed to bring in any service. It is probably the most like interdisciplinary program I have ever experienced. If you just think of, what would your dream setup look like for your child with special needs? This is it. Because I've never been in a place that works like such a team does in this place, and nobody's feelings get hurt. Nobody gets territorial, like, oh, you can't take him out of this class, or that's when I have him for this. It's just everybody works so well together. And, these are his needs. These are his therapies. This is when it has to get done. So he gets all of his PT, OT, speech, all of that done. And then he also gets ABA in the times that he doesn't have that. So, and I just, I know that we've talked about, ABA has some strong feelings, but my experience with it at this school has been nothing but positive. I don't see any of the horror stories that people talk about. He's happy there. It's very positive. We've seen nothing but, positive interactions from him and his therapists. And so it's been really helpful to us. And to be honest, I never would have been thrown into this world of ABA. I really didn't know much about ABA until we got this diagnosis of autism, and it opened up all these doors for us. So even being an SLP, I didn't realize, like I said, I work with adults. I didn't work with kids. So I didn't realize that this was such a sort of polarizing topic. But on my experience, I don't understand why. I haven't seen any of the horror stories that people talk about. So
Well, it sounds like your son is in a great place. So let's pivot a little bit. And SLP is a speech and language pathologist. I've probably done 5 or 10 interviews with other SLPs during the 3 years that the podcast has been on. Love SLPs, love a multidisciplinary approach, especially as a registered nurse. I worked in the neuro field and the rehab field. So it was always multidisciplinary teams, multidisciplinary goals, trying to get people to be more independent. And I think one unique thing that we haven't discussed on the show is there is a difference between a medical SLP and a educational SLP that you would find in the school? I mean, they both have an SLP credential, but can you just explain the differences? Because you're clearly in the medical SLP world.
Yeah. So I mean, you're a nurse, think about it, right? There's a bajillion different settings you can work in. And that's essentially what it is for us too. We all graduate school with the same, degree. We all graduate with a master's degree, but then it just depends what setting you want to work in. So if you want to work in the schools, you might, your focus is more on language, expressive language, receptive language, communication, might be AAC there. If you want to work more in the medical setting, you would be in a hospital or a skilled nursing facility, or, working in an ICU. So helping some of these patients with trachs and vents learn to regain their speech after a stroke or a brain injury, helping them swallow if they have a feeding tube. So it sort of is like two different worlds, quote unquote. And yeah, it just really depends what setting you want to work in. There sort of is also, there's the pediatric medically complex population too. So there are, SLPs that do work with kids, but they work with the more medically complex kids. So that's always a really fascinating area to work in as well. So we all do have the same degree. It just depends which setting you want to work in. And then, just as any medical professional, you just have to go on and learn more, take certifications, take more courses, to really hone in on that specialty.
So your specialty is swallowing. And so why don't you tell our listeners just some of your accomplishments or what you're doing, your podcast, your books, what you focus on with swallowing, because we probably do. I mean, I know we have SLPs listening right now and they may not know of you. And so why don't you tell our listeners what you have for SLPs?
Yeah. So I'm a board certified specialist in swallowing and swallowing disorders, sort of something that I just fell into, to be honest. I thought I would work in the schools. I thought I would work with kids and I just didn't like it. I ended up working in the nursing homes and loved it. So never in my wildest dreams thought that, I would love working with old people, but I totally do. But I just really found this love and passion for swallowing. I think, there's such a quality of life component to it. There's how many times, at birthdays or celebrations or Thanksgiving or Christmas, it always revolves around food. And to be able to take that ability away from somebody is really detrimental to their quality of life. So I just found it to be really something I was truly passionate about. And I just found it really fulfilling to be able to help these patients get, back to eating or drinking, at their, family dinner or Thanksgiving dinner. So I started writing a blog about, maybe 7 or 8 years ago. I had started a mobile fees company at the time, which is a mobile swallow study company. So basically I would contract with the nursing homes and I would bring equipment into nursing homes and do these swallow studies there. Yeah.
Yeah. Because most of the time, if you're in a nursing home and you have swallowing problems, you have to get to the hospital with specialized equipment to get these testing done. Wow. So
so we had the equipment and brought it into the nursing homes. Yeah.
Wow.
Yeah.
So is that nationally now or just in a couple of areas?
So I actually sold that company last year. But yes, I did run it in a few different states. So, but there's companies all over the country now that do it. So
and you were the first to develop that?
No, I was not the first by any means. No, but I definitely was the first in a few states. So
yeah, that's excellent.
Yeah.
That was a possibility.
Yeah. So, what I sort of realized with that was that there was a lot of nursing home like administrators, doctors, nurses that understood the importance of swallowing assessments, but our own field sort of didn't. Speech pathologists didn't recognize how important they were, why they needed them, why they needed the tools, the training to do these things. So I sort of embarked on this education, escapade. So I started blogging. The blog, was popular. It took off. I just didn't have the time to keep up with the blog. So I created a podcast. So I have the Swallow Your Pride podcast. It debuted at number 11 on the Science and Medicine chart, and it has over 3 million downloads. So talk about all things swallowing disorders and, just kept discovering that so many people want to know more about it. So I started a online community, a membership site for medical speech pathologists. We have over 6,000 medical speech pathologists in that community, provide resources, webinars, things like that. I also own another company called Medical SLP Education. It's medslped.com. And that's more solid foundational 8 to 10 hour courses on different areas of medical SLP. And then just realizing that patients need more information about swallowing disorders too. So I released a book last year called So You're Having Trouble Swallowing, and that was an Amazon and Barnes and Noble bestseller. So that book is written for patients. So if you're experiencing swallowing troubles, or if you're a caregiver to someone that's having swallowing troubles, it just talks about what your options are, what tests are available, what treatments are available, what questions you should ask, what you should look for. So.
Okay. Wow. So Swallow Your Pride is the podcast.
Yep, correct.
And medslp.com is the website where you can learn about your courses and your membership.
So medslped.com.
Oh, medslped.com.
Yep.
Okay. Well, we can put those in the show notes if you're out listening and running or driving. We can have everything in the show notes. Okay. So, let's talk briefly about swallowing problems in kids with autism. I know when Lucas was like 1 or 2, we had a couple episodes where he would like be eating bread and like kind of not know when to stop and be choking a little bit. And it wasn't extensive swallowing problems, but and I know I have a whole chapter in my book, Turn Autism Around, about eating. And I know kids who have feeding problems, if they also have other signs of autism, are more likely to have it. And we can link Dr. Keith Williams is a really great episode in the show notes. And he's an internationally known BCBA who specializes in feeding. And he also has done some publications on swallowing and those sorts of things. But so how common, if you know, is swallowing problems in autism?
Oh gosh, I don't know. I don't know exactly that. And I think the hard part is to separate swallowing and feeding,
Yes.
because that's the big separation. And my son has feeding problems. I wouldn't say he has a swallowing disorder. I wouldn't go that far, but he definitely has feeding trouble. So I think that's the hard part, because there's a lot of overlap there.
Mm-hmm.
Yeah, there's a lot there, obviously.
What are his feeding problems, if you don't mind?
So his is really just a strength issue. It's a tone issue. So he's low tone everywhere. Like I said, he's non-ambulatory. So he just has a very, very weak chew. It's very difficult for him to, propel the food, back into his esophagus. So he's not on, he can have some softer foods, but he has trouble chewing. If something takes too long for him to chew, or it's too hard to chew, he'll just spit out. So we're working a lot on just really strength of his chew. So that's just something that we have to be cautious of. And I think what's so fascinating is, he knows what he can and cannot eat. And there's things that, some foods will put in front of him, and I think he'll be able to chew them, and he just won't put them in his mouth, or he'll try to chew them, but just know it's too hard and spit them right out. So, it's pretty amazing, what these kids are aware of themselves.
Yeah. So I did an interview with Mags Kirk, who is BCBA and an SLP for many years, BCBA for a few years, and she's also Talk Tools certified. When you said about low tone, I'm not familiar. I'm not sure if you're familiar with Talk Tools, but
Yep. I've done some presentations for them.
Oh, okay. So
Yep.
You are familiar. So yeah, so we have that interview, which I think might provide, if people are having kids with low tone and chewing and swallowing and talking problems, to be aware of Talk Tools as one potential tool that might help.
Yep.
Yeah. So has your professional work changed at all since having a son with special needs?
100%.
Yeah.
Yeah.
How so?
Yeah. I think what I talked about a little bit before is that I focus so much more on the patient now. I think, when I started as an SLP, and when I was really working and seeing patients clinically, I just thought the research was everything. I thought everything we did had to have a research study. We had to have the most amount of evidence to support something. And if we didn't, it meant it didn't work, or it meant that we couldn't even try that. And everything shifted when I had my son, because what do you do when there just isn't anything to support what's going on with him? There's 9 documented cases of his condition. If everything we did was by a textbook, there's nothing for him to do. So, basically our family preferences has driven a lot of his care. And, that's just one thing that, I preach so much is that I want SLPs, I want other medical professionals to think about what the patient wants, think about what's important to them. A lot of times we have these treatment plans, these, beautiful treatment plans that we think is the best way for the patient or the best way for the kid or the family, and come to find out it's just not even something that's important to the family, or they have something that's disrupting their lives way more than this specific thing. So for me, it's turned everything around in what I sort of preach. And I believe very firmly in the evidence-based practice triad. We need to have evidence, but we need to have patient preference and clinical experience mixed in as well. And I think, especially through COVID, the clinical experience was worth so much because we didn't have research as to why we would do this during COVID, or how we would treat this during COVID, or what's COVID's impact on this. We didn't have research to show. So it really went a lot by the clinical experience. So I think it takes a lot of pressure off of therapists and medical professionals to know that you don't have to know the research in every single, you don't have to know every published study about every single topic. Of course, you need to be familiar with it. Of course, you need to keep up to date with things, but have conversations with the patient and their family, with the kid, have conversations with your colleagues that are used to seeing these types of kids or these specific conditions. And I think there's just so much more we can learn from each other, and stop relying so much solely on the textbooks.
Yes, I totally agree with that. Okay, so before I let you go, part of my podcast goals are not just to help the kids, but also help parents and professionals listening to lead happier lives, be less stressed. So do you have any self-care tools, stress management techniques that you use that you would like to recommend?
Oh, goodness. Probably a lot. I've gotten very selfish in the last year or two, and I love it. I think it's made me a much better mom. It's made me a much better professional. I don't know if people have heard of 75 Hard. It's a challenge. I've done that a few times. You look at it and it seems so daunting. You have to work out twice a day. I just learned
about 75 Hard.
Yeah.
Just like 2 weeks ago, one of my friends, I looked into it and I'm like, that seems a little much for me.
It does, but it's amazing to discover how much time you actually truly have in the day. That I got very intentional with. My time was either me time, it was work time, or it was time with my family. And there's just no time for anything in between. It got rid of a lot of drama in my life. It got rid of a lot of things that I would just be searching Instagram to find answer. You just be off searching things and hoping you'll find the answer, and all that stuff just leaves you even more confused and anxious. And I think once I got really clear on my personal and physical fitness goals, it just made it so much easier. So I'm a big proponent in being selfish with yourself, with your fitness, with eating healthy. I drink a lot less wine now than I used to. And I, have always been one of those that loved wine and thought I needed wine to sort of, cure every rough day. But I realized I think so much clearer, and I'm such a better mother without drinking, which I didn't think I would ever say those words, but
yeah, no, I hear you. So I love that, being selfish, saying no. If it's extraneous things, there's only so much time in a day, and there's only so much time in your life. And so making the most out of it, I think is a great tip and a good way to wrap this up. Well, hopefully everybody enjoyed this interview. I think it was really helpful in terms of a lot of different things, hearing your journey, hearing the combination of a genetic chromosomal abnormality and autism. Even if it's not an official diagnosis, there is help. I mean, my courses, for instance, are like, doesn't matter if you have a diagnosis, doesn't matter if you have a diagnosis of anything. These are just child-friendly practices to help parents become the quote unquote captain of the ship, to make sure that the parent is empowered to know what to do during COVID, after COVID, to coordinate, because there is a lot of coordination that is just falls onto the parent's lap. And so I think You've really helped us understand the differences between medical SLPs and educational ones, and really the value of the multidisciplinary team. So thank you so much for your time today. I hope to keep in touch with you, and good luck with all of your endeavors in terms of helping people learn more about swallowing.
Awesome. Thank you, Mary. Appreciate it.